And there is not a lot written about the lower incisor position.
Sorry, I couldn't help it.
Shock, you know, I was watching you lecture earlier, and one of the things that came to mind when we're talking about the leveling of the soft tissues,
Right.
You know, to establish proper gum line, which is part of the aesthetics of the smile.
Absolutely.
Besides extruding the long tooth to match it with a short tooth, we have other tools to do that. Can you just run them by me?
Well, absolutely. You know, whenever I think about vertical changes, I like to look at different tools that we have, you know, whether it's a bend or whether it's a skeletal anchorage, and I'm really interested in learning about the different things that I can do to get better gingival aesthetics for my patients. I don't know if you could tell me about things in the update or no.
Well, one of the things that we will cover, it's the gingival margin. The gingival levels as part of the smile, as part of our makeup of our patient. And one of the things that I see many a times is when we have different soft tissue levels between central incisors, for example, the most common thing that I see people do is they extrude the long tooth, and then they shave the incisal edge and might put a veneer or not. But when we look at the smile carefully, sometimes the long tooth is the one that has the right gingival architecture. And if you extrude that long tooth, then the gingival architecture might not be as nice.
Right.
And what a lot of dentists don't do or don't think about is why don't we intrude the short tooth?
Absolutely.
As we intrude it, the tissue will creep up with the short tooth. And then we can just do an incisal restoration or a veneer, and we will create a much nicer gum contour. What do you think?
Well, that's one of the things I find with students is they have a hard time incorporating all the different aspects of dentistry into their ortho, and they don't get quite as comprehensive of a treatment plan. They just look at the ortho aspect, and then the restorative aspect might be an afterthought. So, you know, I hope during the update we can spend some time, you know, incorporating the different aspects of dentistry so that the student can get a more comprehensive treatment plan so that they can treat their patients in a better fashion and give them a better overall treatment plan.
Well, one of the reasons that we selected this topic for the update is because, you know, pretty much in the profession, orthodontics is being seen as a separate branch of dentistry.
Absolutely.
It's straighten teeth, make them function in a better bite, and give aesthetics. But actually, orthodontics is a part of dentistry.
Absolutely.
And all dentistry. And planning our cases, whether it's a restorative case or not, without considering orthodontics, or planning an orthodontic case without considering restorative, it's actually a major flaw in the profession.
I agree.
So the objective is to really be able to combine all the science in dentistry, ortho, restorative, perio,
Right.
function. So when we look at the case, we can have a much broader view that will allow us to really plan our case from day one, not until we take the braces off, but until the patient gets their final restorations.
Well, I've always looked at the fact that ortho does improve everyone's ability to practice dentistry, not just the orthodontic aspect, but it gives them a better education as far as how to treat somebody's just routine dental needs. So I think in addition to providing aesthetic benefits, I look forward to helping people learn the functional benefits and the ways that they can improve themselves as a general dentist in addition to their orthodontic practice.
Well, they are going to, after the update, they're going to be able to visualize all the cases in a much profound way. Not only from the aesthetic orthodontic way, but also the restorative, periodontics, temporomandibular joint dysfunction, Orthodontics plays an important role on everything we do every day.
I agree 100%.
And this is the reason why we're working into the multifactorial, or, you know,
Yeah, multidisciplinary
approach to dentistry, where orthodontics is long being forgotten.
Absolutely.
We're going to be dealing mostly with adult patients, because that's where the multidisciplinary approach to dentistry comes about. And we're really going to learn how to look at an adult patient correctly. Adult patients are not the same as young individuals, teenagers or adolescents that still have growth to come, that you typically come in with 28, 32 teeth in the mouth. Adult patients present themselves with abrasion, broken fillings, broken teeth, missing teeth, I mean, an array of problems.
Absolutely.
And we're going to be able to, with a multifactorial approach, a multidisciplinary approach, to really get the best diagnosis and the best treatment for these patients. Chuck, you and I have worked together on previous updates and have worked together for so many years.
Absolutely.
And it's always been a pleasure having you as part of my team. You're one of the most intelligent doctors I know.
Well, that means a lot. And one of the most intelligent doctors I know.
Thank you. And we've been working so hard on this update.
Yes.
Going through tons of literature to review.
Yes.
Hours of looking at cases. I'm really looking forward to have a lot of students coming to the update.
I am
too.
They will benefit. I am too. I think it's going to be a fantastic update, and I look forward to seeing all of you there. And I can't wait to improve your education just like POS always has.